Hi everyone. Today let's talk about dysmenorrhea. Okay, so dysmenorrhea is basically the pain that actually you feel during your menses. Now, there are two types of dysmenorrhea, namely the primary and the secondary. Okay, the primary is basically dysmenorrhea that is recurrent, meaning you have it every cycle or every menstrual period, and it is usually not related to any other illnesses. Okay, so secondary dysmenorrhea actually, on the other hand, is because of diseases that are present in the female reproductive organs like your endometriosis, your adenomyosis, your pelvic inflammatory disease, or myomas. This begins earlier in the menstrual cycle and it lasts longer. And usually this kind of dysmenorrhea is not accompanied by any other symptoms. It's just purely pain, which is actually also felt in the lower abdomen, lower back, and sometimes it actually can radiate to the inner thigh. Alright, let's now talk about the causes of dysmenorrhea. Now, for primary dysmenorrhea, usually the cause is because of prostaglandins. Now, intermittently, our uterus actually contracts, but during menses, it contracts a little stronger than usual. And what happens is, with these strong contractions, it now actually creates a pressure on the nearby blood vessels. And because there is now actually pressure on the nearby blood vessels, this actually temporarily causes a loss of blood supply. The brief loss of oxygen actually causes the pain. Okay, so let's now go to the causes of secondary dysmenorrhea, namely endometriosis, adenomyosis, myoma, pelvic inflammatory disease, and even cervical stenosis. So let's go to the first, endometriosis. Endometriosis is actually defined as normal endometrial glands located in abnormal locations. So what do I mean by this? So technically every month you shed actually endometrial lining as in the form of menstruation. So 80 to 85% of the lining of the uterus goes down as menses. However, there's that 15 to 20% that goes up and outside and goes into the fallopian tubes and outside into the abdominal cavity, and this is called retrograde menstruation. Now, when it goes outside of the fallopian tubes, it now implants in the nearby organs, like, say, for example, the ovaries. It can implant in your intestines or your bladder, or even on the top of the uterus and in the rectum. Okay, so as I've said, these are normal glands now in abnormal locations because they're not supposed to be there. However, since they are normal glands, they still undergo the monthly cyclic changes that the lining usually undergoes when it is inside the uterus. So it also menstruates every month. So now blood is not supposed to be in the abdominal cavity. It's supposed to be in the blood vessels, or it may be inside the uterus when you have your menses. So even the small amount of blood inside the abdominal cavity can now cause irritation. Thus, patients now feel this as abdominal pain during menses. Okay, so next, adenomyosis. Adenomyosis is technically the generalized thickening of the myometrium, or the muscle layer of the uterus. So the most common manifestation of adenomyosis is dysmenorrhea. Okay, adenomyosis happens when the lining of the uterus goes inside the muscle layer of the uterus and causes now a generalized thickening of the whole muscle wall. Okay, so this now causes pressure, thus patients now experience this as pain. Okay, myomas, on the other hand, are localized thickening of the muscle layer of the uterus, and the pain is also caused because of pressure symptoms. Okay, so cervical stenosis is actually the narrowing of the entrance of the uterus, and so pain may actually happen because when the uterus tries to contract and expel blood, there's actually a smaller opening for the blood to come out, and so it causes now some pressure, okay, now felt as pain. All right, so pelvic inflammatory disease is actually infection in the reproductive tract caused by bacteria, and the inflammation caused by the infection can now also manifest as pain because of the release of certain chemicals. And as I've already said, pain can actually be felt in the abdomen or the lower abdomen. There is also a feeling of pressure in the lower abdomen, and pain can actually radiate to the lower back, the legs, and the inner thigh. Now, if you're experiencing severe dysmenorrhea, it would be best to actually seek consult and schedule an appointment with your OBGYN. And if you're actually experiencing prolonged bouts of pain, it is also actually very important that you again ask for help. Okay, now both primary and secondary dysmenorrhea can be treated, so it would be best to actually get checked. Okay, so what do we do when you do come for checkup? So of course we need to do a pelvic examination. We can actually do a speculum exam to visualize your cervix and your vagina, and then we can do an internal examination and palpate for possible lumps and bumps that may be present just in case you have endometriosis. Now, if you have secondary type of dysmenorrhea, we can request for other ancillary procedures like ultrasound. Okay, so it is best to actually come to the clinic or actually do a teleconsult so that we can decide on what best workups you need to undergo for us to make a diagnosis and for us to be able to give you the right treatment. And just a note, if you are using tampons and you actually experience the following symptoms like fever of greater than 39 degrees, you have dizziness, you have nausea and vomiting, and you feel faint, or you actually have a fainting spell, and then you notice a rash that looks like a sunburn, okay, you may be experiencing toxic shock syndrome, and this is actually a life-threatening disease or a life-threatening illness, so it's best you get checked ASAP. Okay, now let's go to the management. So you can actually do some lifestyle changes like incorporating exercise in your weekly routines. So 2 to 3 days of 30-minute exercises can actually help increase your endorphins, and this can actually decrease your experience of dysmenorrhea. Drinking a lot of water also will help, okay, lessen the chances of you having dysmenorrhea or you experiencing painful bouts of dysmenorrhea. You can also take pain relievers, okay, so you can take it the minute that you start feeling some uneasiness. You can take ibuprofen, okay, or any NSAIDs that actually you are used to, and you can take it round the clock for the first 24 to 48 hours of your menses. However, let me just tell you that this may decrease slightly the flow of the menses, so just try to take note of that, and you tell your healthcare provider or your OBGYN about this when you seek consult. Okay, it's also helpful to put warm or heating pads or a warm bottle of water over the lower abdomen. Okay, rest is also very important. In terms of your diet, I would suggest that you avoid taking caffeine and alcohol during the time that you're having your menses, and if you can actually avoid smoking, this will also help improve the bouts of dysmenorrhea that you have. Having massages also actually help. Massaging the lower back and the lower abdomen will also actually help. Now, however, if the medications or all these things that I've already mentioned are not helping, we can actually now look for other options. So it's best to actually again see your doctor. I cannot stress this enough, so that we can actually tailor fit the treatment to you. So okay, so some patients, we start them on oral contraceptive pills, and we actually observe every 3 to 6 months her response, okay, so in terms of the decrease in the intensity of the dysmenorrhea. And aside from the oral contraceptive pills, there's actually a medicine now, and I will mention the brand, although this is not a sponsored post, okay, so this is called Visan. this medication is specifically given to those patients experiencing pain or dysmenorrhea due to endometriosis. So, but do not self-medicate with this because there are a lot of precautions, and we need to actually examine you first and get your history and do some lab tests before you start you on this medicine. So it would be best to actually use this under the guidance of your OBGYN. So with that, hopefully you found this video informative. So again, don't forget to give us some love. Okay, and if you have any questions, don't forget to write your comments or your questions in the comment section below. So thank you very much again for listening. Stay safe and God bless you, everyone. Bye-bye.